So we're talking about urinary tract infections, and as with all these Family Doctor Expert videos, you should see your doctor, and this is information for general advice. But urinary tract infections are very common. Usually people come in more often, women and men, complaining of needing to wee lots, painful wee, feeling like they need to go and getting there and hardly having any wee to pass. And so they usually know what they've got. In some of the older women that we see, often they won't have the urinary symptoms per se. They might be feeling a bit achy in the body and fluey, or even sometimes a bit confused. When the blokes come in with urinary tract infections, we're a little bit more concerned because they're a bit rarer, and we will often want to perform further investigations like ultrasounds and things to see if maybe there's a prostate problem or a kidney stone problem. So, as I said, urinary tract infections are really common and they're generally not serious, but they can be. So, just to get a few definitions right, the common ones that we see are in the bladder, which we call cystitis, but there's also infections that can affect the urethra, which is that little tube at the end of the penis or just above the vagina, and if you get an infection there, that's called urethritis, and that's usually of a different category. Different sorts of bacteria such as chlamydia or mycoplasma can affect the urethra, and then we're more in the territory of possible sexually transmitted disease and possibly treating your partner. But the good old garden variety cystitis, bladder infection is what we see most often. One of the things we're particularly interested in is whether or not that infection is going up from the bladder and into the kidneys and causing what we call pyelonephritis. And pyelonephritis is a kidney infection and can be quite serious, and if it keeps going on untreated can actually scar the kidneys and cause problems. Sometimes that infection can get into the blood, causing a sepsis, which is also pretty serious. So generally if someone's getting fevers, we're a little bit more suspicious about that as well. So your doctor no doubt will want to do a urine test to look for the bacteria, signs of infection, but also we'll have a look if there's any blood in the urine as well. The doctor might test it here and there, right here in the practice with one of these little dipsticks. So the doctor literally dips this into the urine, and because the change in colour will tell him or her what's happening. But they might send your urine off for a culture to see which bacteria it grows, and that's particularly helpful if people are getting recurrent urinary tract infections. Now when you get sent off to the bathroom to do a urine infection, it's better a urine sample. First of all, you need to do what we call a clean catch. So usually you'll be given a little tissue or something to wipe the genitals first, and then try to get what we call a midstream catch, which is when the urine's already passed a bit and you put the little container in the way and get a midstream sample of the urine. That's a bit more accurate. So it's going to be a few days till the urine results come back, so usually the doctor will treat with antibiotics straight away, and it's important to take the whole course, and they're usually very effective. There are some flags that will make the doctor a little bit more worried. You know, if you've got a propensity to infections, might be diabetic or have some immune problems, or might have had kidney troubles in the past, or using a urinary catheter, something like that, the doctor might be even a bit more cautious. There's a range of non-medication things that you can do if you've got a urinary tract infection. Drink lots of water. There's a couple of over-the-counter preparations like Ural and others that can make the urine less acidic and less painful. Other things to prevent recurrent infections, have a wee after sex. When you wipe yourself after the toilet, wipe from front to the back for the ladies. There's a bit of evidence around cranberry juice and a bit of debate as to whether or not it's helpful, but it might be worth trying. And so they're the sort of the main things to know about urinary tract infections. Now if they are recurrent or complicated or serious, there's a whole range of additional tests that the GP might want to do. A common one is an ultrasound to look if there's any kidney stones or something wrong with the kidneys. And then there's a whole swag of specialised tests, CT scans and MRIs and urodynamics, which I don't understand exactly how they work, which a specialist would do if you were having lots of urine troubles. So, I hope you get better, and thank you for listening to familydoctor.expert.